Welcome to today's episode of the Be Sure podcast. Living with epilepsy involves challenges beyond seizures, including stigma and emotional impact. However, with the right treatment and adjustments, many people with epilepsy can lead active lives. To help us better understand this, we are fortunate to have a renowned consultant neurologist with extensive experience in treating epilepsy. Welcome, Doctor.
Good evening, everyone. Myself, Dr. Ayush Jain. I am here, senior resident doctor working in NIGRIMS as a DM neurologist. So, I will be talking today about understanding the epilepsies, the essentials for epilepsy. Can we proceed with the questions?
Let's start with the basics. What exactly is a seizure and how does it affect the brain?
Okay, so basically, the International League Against Epilepsy, ILE 2014, they have defined a seizure as a transient events of signs and symptoms of abnormal excessive hypersynchronous discharges. So, the brain it uses a tiny electrical signals to control everything we think, we feel, and we do. So a seizure happens like when a person brain is overloaded by abnormal amount of electrical activities. Some doctors they describe seizure as a storm in the brain. So during a seizure, a person might lose consciousness, shake or convulse, become confused, or even feel panic or there is a fear in the patient.
What is epilepsy?
So against the it is very different from a seizure. Similarly, the International League Against Epilepsy they have again defined epilepsy. In general, the epilepsy is a medical condition that causes the person to have repeated seizures. So, we as a doctor, we defined as epilepsy as two or more unprovoked seizures occurring within 24 hours or unprovoked means the seizure weren't caused by something else like high fever or severe infections or a seizure of unprovoked nature with a high recurrence of more than 60% in within 10 years of this. And also epilepsy syndrome can also be diagnosed as an epilepsy. So epilepsy can include many different types of seizures. While some people only have one type of seizures, other may experience more than one type.
What are the different types of seizures and do they affect people differently?
Yes, there are different types of seizures, and it affects different people with different ages differently. So, ILAE again they have classified seizure as generalized onset seizure, or it can be a focal onset seizure, or it can be unknown onset. That further divided into motor and non-motor. So it depends on where the unusual activity starts in the brain and how much the brain is involved. So we usually classify seizure as either generalized or focal. And as the term generalized, it suggests that it involves the entire brain, while the focal seizures, it's start in one specific area.
I see. Now, can you explain what causes epilepsy? Is there always a known cause?
As such, there is not always a known cause is there. Like about more than 50% of the patients with epilepsy, we do not find any specific cause. So, but for other 55%, we are having common causes like brain infections can be there. There can be any head injuries or there can be tumors are there. So, like for elderly, like more than 65 year of age, stroke and other risk factors like Alzheimer's can also lead to epilepsy. And other causes may genetic causes like sometimes plays a very specific role, especially if there is no other identified cause is known. And there are different studies and researchers they have say that certain genetic factors might make people or patients with epilepsy more susceptible and they develop epilepsy.
Well, that's really helpful to understand. Well, what are some of the signs or symptoms of epilepsy that caregivers should look out for?
So, epilepsy, it is important to know about the signs and symptoms, as the signs and symptoms, what we call it semiology, means there is we can localize the lesion where the seizure or epilepsy is originating. So, symptoms can vary a lot, but some common signs that a seizure includes like sudden conversion, means there is a jerking body movement is there, or patient may lose consciousness, or patient may stare off into the space, there is a confusion is there, and even the patient may have like very fearfulness, and there is a strange feeling in the patient. So some people may even shake in just one part of the body, or like an arm or leg. So if all these like symptoms or signs are there, so if someone, you know, these symptoms more than once is happening in the patient, so it's a good idea to come to a doctor or to a neurologist.
Now let's talk about something that many people with epilepsy face: stigma. Can you tell us why epilepsy is often misunderstood?
Yes, this is very important, and unfortunately, epilepsy has been misunderstood for a long time. So, as historically, people they didn't realize that epilepsy is a neurological condition. Even all over the world, it is like that, and even myths developed around that. So, seizure, as such, to a person, it looks very frightening. So, people may react with fear, or even patient like even they avoid the patient, which is the main cause of stigma in the people. Yeah, stigma can people affects people with stigma also. So individual with epilepsy often face negative attitudes and discrimination from others. Even they are having reluctance to like attitudes like to marry people with epilepsy, and even they are unwillingness to employ them. Even there is they don't want to sit with some vicinity with there is aversion with them. And even like in children, they discourage their children to play with them. So these stigma can sometimes be thought of that there is high chances of increased frequency of seizures from these stigma, and they can act as a trigger for these seizures. So that's why it is very important in the community that it should be informed and it should be supportive.
Absolutely. Now let's move on to managing epilepsy. What are the common triggers for seizures that patients and caregivers should be aware of?
Okay, so triggers are many actually, and many times we don't know what happens and what are the triggers. So the commonest triggers that we encounter is that patient with epilepsy coming is due to non-compliance of medications. So patient misses the dose of seizure medication. So it is very important to have a compliance of the patient. The other causes that can trigger includes like sleep. So there is reduced sleep can increase the chances of having more seizures. There is also other stress, skipping meals, or like certain foods are there. Also like certain factors like fever or illness, or flashing lights, or in women also there is in during the menstrual period the hormonal changes are also there. So it is very much a doctor should tell the patient and or people to make a seizure diary to track the possible triggers that could make it easier to notice the patterns.
Thank you so much, Doctor. To wrap up, could you share some safety tips to help prevent injuries during seizures?
Yes. The safety tips that could be prevent is at home. It is wise to clear away the things that could lead to fall. So there are clutters, there are cords, and also there are pads, sharp corners on the tables. So in the kitchen, when we go in the kitchen, so we should use non-breakable dishes. Even if a person is living alone, they can use a microwave oven rather than a stove. Also, placing soft carpet can help reduce injury risk if someone does fall during a seizure. So these are the certain precautions that are simple but it can make a huge differences.
Thank you so much, Doctor. This has been incredibly informative and helpful. We hope today's discussion helps listeners better understand epilepsy and how to support themselves or their loved ones, of course. Any final thoughts?
Yes, thank you so much for giving me this opportunity. So, just remember, with the right and specific treatment of epilepsy, many people, or certainly like all people, maximum people with epilepsy can manage their condition well and can lead full lives. So, being aware of the triggers, particularly like healthy habits, even the compliance, and also sleep and having support, it makes a big difference. So remember that you are not alone. There is a community of support out there for epilepsy patients. Thank you.
Thank you, Doctor. And thank you to our listeners. Until next time, take care and stay informed.